Now we'll talk about a very important bone disease again, and this is what is known as a basic calcium phosphate disease. Basic calcium phosphate disease. Alright. So for the basic calcium phosphate disease, it's as follows. So it's a crystal induced arthropathy, and it's caused by deposition of what hydroxyapatite crystals in joints and also the periarticular tissues. So it's actually part of the spectrum of it and types of disease that we call crystal associated musculoskeletal disorders, similar to gout and also pseudogout. Okay, so pathophysiology, the crystals involved are the hydroxyapatite, so you can see them. Okay, no, well, no, these are the crystals. This one is the joint degeneration, but of course the crystals that cause the degeneration, right? So they deposit in tendons, they deposit in ligaments, they deposit in the bursae, they deposit in the periarticular soft tissues. So mechanism, the crystals, they will now stimulate macrophage and synovial cells, leading towards release of inflammatory mediators and enzymes that damage the cartilage and the surrounding tissue. So there's a lot of inflammation locally, there's tissue degeneration, and it can also cause the destructive arthritis. Okay, so clinical features, you are having the Milwaukee shoulder syndrome. So it's a classic presentation of the basic calcium phosphate deposition disease. Okay, usually seen in elderly women. It's characterized by shoulder pain, swelling, and massive rotator cuff destruction. So synovial fluid often contains hydroxyapatite crystals. Other issues, that's other places that could have issues, include the knees, the hips, the wrist. Symptoms, there are a lot of pain and limited motion, range of motion. Okay, effusion with relatively mild inflammation. Okay, so you diagnose it from analyzing the synovial fluid. Special technique like all those words, alizarin red S staining, okay, or electron microscopy, just to dictate those crystals. Then also imagings. So you manage it by using all those non-steroidal anti-inflammatory drugs, and also the colchicine and corticosteroid injections. Physical therapies to maintain mobility. Okay, and joint replacement if the issue is so advanced. Okay, so that's what we got for this